Welcome to Washington Watch with Congressman Walter Jones. Each month, we take a look at the events happening in Washington, D.C. and how they affect our lives here in eastern North Carolina. And now, here's your Congressman, Walter Jones.
Welcome to the August edition of Washington Watch. Today's guest is Congressman Tom Price. Congressman Price represents the 6th Congressional District in Georgia. He serves on the House Financial Services Committee as well as the Committee on Education and Labor, where he is the top Republican on the subcommittee that oversees health care, the Workforce Protection Subcommittee. Before his election to Congress in 2004, he served 4 terms in the Georgia State Senate. Congressman Price has spent nearly 20 years in private practice as an orthopedic surgeon. He and his wife Elizabeth and their family reside in Roswell, Georgia. Tom, welcome to the August edition of Washington Watch. I am tickled and thrilled and very much appreciate you being on the show.
Thank you, Walter. Just great to be with you. We appreciate the opportunity.
Tom, because of your 20 years practicing medicine, you bring such, really intellectual expertise, if I can, to this debate about health care. Tell me, because I want to first thank you, I want the people to know back home that this man, along with his colleagues, many of them doctors like himself, have been on the floor talking about President Obama's health care plan. And Tom, I want to start this way because since February I've seen a large number of doctors, hospital administrators, nurses, and the one thing that always came back from all those 3 groups, we do have some issues that we need to deal with health care, but let's not rush through that. Let's take them in increments, one at a time. Sure. Let's start dealing. Tom, share with the people of the 3rd District of North Carolina your feelings about where we are on this health care issue.
Well, thank you, Walter. And again, I appreciate the opportunity to share some views about something that's near and dear to my heart as a practicing physician for over 20 years. The issue of health care really is the one that drove me into public service. And you're right. We ought not rush this along because the health care decisions, medical decisions that you make and that I make and that all Americans make are some of the most personal decisions they'll ever make in their lives for themselves and for their family. And so to think that we would just run willy-nilly as rapidly as we could through this process just is not responsible. So as you know, many of us have been saying, look, time out, we need to slow this process down a bit and allow not just us to see what's in the bill, which is a good idea, but allow the American people to see what's in it, because there are major changes that are being proposed by the President and by the Democrats in charge right now.
Tom, if you would mention one or two, because you're on the committees that are reviewing this legislation as it moves through the House. If you could share with the viewers of the 3rd District a couple of your real concerns about what you see in this bill, and then I will have another question for you.
Well, I think the big question, the real issue is who are we going to allow to make medical decisions in this nation? Is it going to be patients and their families along with a caring and compassionate physician? Or is it going to be the federal government, which is really the plan of the other side? There's this notion out there that we're either going to put the government in charge or insurance companies in charge. I believe, as I know you do, that there's another alternative. There's an alternative to make it so that patients and their families have the right and the responsibility and the authority and the privilege of making those medical decisions for themselves and their families. That really is the big issue and the question that we have to answer as a society. And this isn't a done deal yet. This isn't a done deal. All of these issues are in play.
Well, Tom, I know that the Republican Party, and you've been very instrumental in helping to draft the Republican alternative. Can you maybe touch on 1 or 2 or 3 points of that effort by you and your colleagues?
Sure. Again, that decision-making, where are we going to have those decisions made? And we believe strongly that they need to be left with patients and their families and physicians. In order to do that, you've got to make certain that patients own and control their insurance coverage or whatever coverage they may have, regardless of who's paying for it. And so those are the big issues. One thing that is being avoided completely by the Democrats in charge right now is the whole issue of liability, the whole issue of malpractice and liability reform. And that's something that results in what some of your constituents may have heard of is called the practice of defensive medicine. And defensive medicine is when doctors may order tests or may order extra tests or extra studies that aren't harmful to the patient, but they aren't necessarily needed in order to make the diagnosis. They're done more in an effort to try to make certain that if the physician is ever brought to court, is ever sued on a case, that they're able to say, look, I did all that I could do. So it's in the best interests of the patient, but it may be redundant tests or duplicative tests. I believe that that comprises fully $250 or even $300 billion a year, which is about 10% of the costs of health care in our nation. Those are the kinds of savings that we could realize and actually reform the system in a positive way.
Tom, what I don't understand is about this administration, and let me say this, I've said it many times on this show, he's our president.
Mm-hmm.
I wished him well for this reason. We all benefit as Americans.
Sure.
But what I've yet to understand is why there is such a, maybe it's more from Speaker Pelosi and her leadership than even the White House. I don't know that. That's what I want to ask you. Why do you think there is such a rush to to get a major change in our health care system and try to do it in the first 7 to 8 months of a new administration? I can't rationale why this is taking place the way it is right now.
Well, there are only two logical explanations that I know of for rushing this issue, something so important as these personal medical decisions through. First is that you think that you're not going to be as popular as you are right now, and so you gotta use your political capital right now. You got to use the power that you have right now in order to get something through, and that's not a reason to rush it through. And the second is that you don't want people to be able to tell what's in the bill. We had the bill in our committee last week. It's over 1,000 pages. We got the bill put before us at 10 o'clock in the morning, and we worked on it for literally 20 hours straight till 6 o'clock the next morning. And then we had to vote in committee shortly thereafter, within 3 hours. So this was less than 24 hours for a 1,000-plus page bill in our committee before we were forced to vote on it. That's not the way to do business here. That's not the way that I tell my constituents at home. That's not the way that you and I learned about it in our government class or our civics class. It's not the most responsible way to solve the challenges that we face, which are real. There are real problems that we have in our health care system. The status quo is unacceptable. But it doesn't mean that you just rush something through and make it so that people don't have an opportunity to responsibly and soberly reflect.
Tom, I asked my staff, and in fact, I just got it today. I'll read one paragraph to you, and then I've got a question. In 1966, Medicare cost $3 billion. The House Ways and Means Committee estimated that Medicare would cost only about $12 billion by 1990, and this includes for inflation. This was a supposedly conservative estimate, but in 1990, the Medicare actually cost $107 billion when it was projected in 1966 to cost $12 billion. This is why, again, I want to thank you and those of your colleagues who have been on the floor night after night doing what they call special, 1 hour special orders, and having a dialogue for the American people. And many times I'm sitting in my apartment. I watch y'all too, by the way, so maybe I can't get enough education. But this is what really people back in the 3rd District are saying to me. You are projecting it's $1 trillion cost, and who's to say in 10 or 15 years, should this become law, that it could be triple that?
It could indeed. In fact, the Congressional Budget Office, the office that's charged with trying to determine how much this costs, has been notoriously underestimating the costs of all sorts of programs to the federal government. And it's not because they can't figure out how to do it. It's because the rules that we encumber them with, that we saddle them with, make it so that it's very difficult to project. But in the way in the manner of health care programs that the federal government has responsibility for, they've got responsibility for 4 main programs. 1 is Medicare, 2 is Medicaid, 3 is the Indian Health Service, and 4 is the Veterans Administration Health Service, the health programs for veterans. Each and every one of those has had cost overrun after cost overrun after cost overrun. So if this were to only be $1.3 trillion, which is what has been projected so far, it would be the first time that a program came in where it was budgeted to be. So this will cost a whole lot more than that if it went into place, and and that might be okay, Walter, if it were to reach its stated goal, and that is a higher quality of care and more accessible care. But as I believe, and as many individuals believe, it will decrease the quality of care in our nation. It will decrease accessibility to care in our nation. It will decrease, in fact, affordability. And it will decrease choices for the American people in health care. None of those things are good. And so we ought to move in the correct direction. There are positive solutions that are out there.
Well, it's my hope that the people in the 3rd District, they have been calling their congressman, that I assure you, and I want to thank them for those calls. But I believe sincerely both sides, Republican and Democrat, have faced the fact that we do have some issues with health care that we need to address. But as you've just said so eloquently, we need to do it in a slow way that we can make sure that what we try to fix stays fixed and is not broken 10 years, man, and another Congress has to come back and try to fix these issues. Let me ask you a little bit about the politics of this. As you and I both know, there's a group called the Blue Dogs. Many of those are on the committees that you serve on. They have pretty much taken a stand. Now, we got a couple of weeks before that vote's coming at the end of this month, but of July. But do you feel like that this train is going to slow down? I mean, you can't say it so much because you're like I am, we're in the Republican Party. But do you feel like there's a chance that some of those Democrats who you know, and I know too, they might be able to slow this train down?
Well, I think if you look at the past 6 months of this administration and the leadership out of Speaker Pelosi and the Democrats in charge right now, that they have really run roughshod over not just our side of the aisle, but many members on their side. And so with the spending bill that we had, the nearly $1 trillion spending bill, with the budget that was passed, and with the national energy tax, the cap and trade, cap and tax bill that was recently passed, I think members have heard an awful lot from their constituents. And these Blue Dog members, the 50-plus moderate Democrats, self-described moderate Democrats, I know they're hearing what you're hearing from your constituents and what I'm hearing, and that is that people say, look, you aren't reading this legislation, you're not acting responsibly, we need some checks and balances in Washington. Let's slow the process down a bit and make certain that you're attending to what you ought to attend to. If they stand up now, then we will have a more responsible work product, and it'll be more appropriate for the American people. And I'm encouraging them to do so. I know that you are, and I'm hopeful that they will have that backbone that is so necessary.
Tom, being a practicing physician at one point, many of the doctors that have been to my office and other members' offices are talking about the Medicare reimbursements, their concerns about the fact that, and if you'll touch on this from your experiences, and also the concern is that if we don't address this reimbursement, that many of these doctors, one or two things, they will not take Medicare patients, or they might even at some point just have to say, I can't continue.
Sure. The whole issue of physician reimbursement is a touchy one because people say, well, physicians make enough money. They don't need any more money. And most of them make a pretty good living. The problem is that the rules that Medicare has in terms of the regulations that they have and the reimbursement make it so that it becomes more and more difficult for physicians to see Medicare patients. So I know that it's true in your district. It certainly is in mine, where a new Medicare patient, somebody just turning 65 years of age, has real difficulty finding a doctor who will see a new Medicare patient because of those rules and because of the reimbursement. And that's why I talked a little earlier about accessibility, the ability of patients to actually see a doctor, being decreased or going down or not being as good with a government-run program. We've seen it in all the other programs, and there's no reason why we would conclude that if the government takes over health care now, that we won't see it in that program. Because many doctors will say, look, this is just too much of a hassle. It's not what I bargained for. It's not allowing me to care for my patients in the way that I was trained and in the way that I desire. And if I'm not able to care for my patients the way that I believe to be most appropriate, I'm not going to do that. I'll go find something else to do. So it's these very personal medical decisions that patients make in concert with their families and their physicians are being threatened by the proposal that we have before us.
Well, I have seen so many doctors that the passion you just exhibited, Tom, and I want to thank you for that passion to those that are watching this show, is really what I hear from doctors. Yeah. I mean, it's one of those things that the whole issue of tort reform, and you touched on that just a few minutes ago, that doctors now are really in a very difficult situation, because between the federal government and what they're trying to do, and then the concern about whether I need to have 3 tests to check to see if this is has given me everything I need, or I'm going to have a 4th test. I wish you'd touch on that briefly, because as far as I'm concerned, tort reform needs to be part of this package.
Absolutely.
It needs to be part of that.
Yeah. And the doctors feel pinched. On the one side, they believe they need to do as many tests as necessary to make certain that the patient is being treated correctly, and that there are no problems that they're not catching. And on the other hand, as I think you probably know, the federal government is hiring individuals to go out and to look at physician practices specifically for doctors that are ordering too many tests. And so the doctors are pinched on the one side of trying to make certain that they're caring for their patients in the best way possible, and at the same time protecting themselves from liability. And on the other hand, having the federal government looking over their shoulder and saying, now wait a minute, Dr. Smith, Dr. Jones, you're ordering too many tests. Now why are you doing that? And then punishing them, and in fact having the ability to fine the doctors, or to actually bring them up on criminal charges, which is just astounding. When I went to medical school, too many years ago, but when I went to medical school, I didn't have any of my colleagues at that time who wanted to go out into the practice of medicine and do a bad job. I never met a doctor in my entire medical practice who said, boy, oh boy, I hope I do a bad job today. Every single one of them wanted to do the best job they could for their patients. And right now, we're looking at a bill that would limit the ability of physicians to care for their patients in the best way they know how.
Tom, let me ask you about the AMA, which prior to this interview, they publicly said that they supported this bill. And knowing you have today, as I've heard you many times on the floor and in the caucuses, you articulate so well your concerns about keeping the profession strong. Were you surprised that the AMA, and I don't know that much about the politics of these groups, but were you surprised with that endorsement by the AMA?
I was surprised, Walter, and I was because the AMA has a tough job, there's no doubt about it, because they're the Federation of Medicine. They're supposed to represent all physicians. Now, there are some physicians in the United States who believe that the government ought to be running the show. They're a minority, but they believe that a single-payer system is appropriate. So the AMA is in a tough situation. I would suggest to you, however, that I think that one of the reasons that the AMA and some other organizations that have come out in support of the plan that's available to us right now from the Democrats is that they have been told that if they aren't supportive of this at the beginning, that they will lose the ability to have input toward the end. That's not the best way to make decisions in this system. The best way is to allow all individuals to come to the table and share their expertise and share their knowledge and share their passion about those things that they are most familiar, but not to extort support from one side or the other. We have really damaged our body politic and our ability to discuss remarkably challenging issues if we're forcing individuals to the table and forcing them to say things when they might not necessarily agree. Now, I don't know if that's the case with the AMA, but I think that they're compromised because of the desire that they have to want to be at the table at the very end.
Well, Tom, I think we have about 3 minutes left. I want to thank you for that explanation, your opinion, because I was a little taken back. Particularly, we all know that the president was losing momentum, and I think they were hoping that maybe that endorsement by the AMA, and I think it was a nurses group too, would give them some momentum. But I think right now the people are looking at the bottom line, the cost of it, and as you said, to assure that patient can choose his or her doctor.
There are all sorts of principles that people espouse about health care, but I would challenge your constituents to think about their principles. What are their principles about health care? Many folks talk about accessibility and affordability and quality. I add responsiveness and innovation because I think those are the important things. And I also add patient choices. But I would challenge your constituents to think about their principles of health care. And I would also challenge them to name a principle for which the intrusion, greater involvement of the federal government helps.
Right.
None of those principles are helped by the greater involvement of the federal government. So regardless of where you think the system ought to be going, I would suggest that the solution is not greater involvement by the federal government.
Well, you and I agree on so many issues, and certainly that's one that I will always want to believe that the American people should have a right to, particularly as it relates to health care, to have a choice when at all possible. And certainly I know that most of us believe that the doctors that we have gotten to know through life, and even for a child, that the doctor that he or she feels good with is the one that they want to keep seeing.
Absolutely. People ought to have that right, and they ought not to have that picked by the federal government.
No, and Tom, I want to thank you. We've got about a minute left, and I really, this has been one of the best shows we've had in a long, long time, and it's because of the subject, quite frankly, and to have a person like yourself who's on the inside and now in the Congress, that you can really have an influence on how this bill moves forward, even though we're in the minority party. Yes. It's because you have the knowledge that you can articulate to your colleagues on the floor of the House.
Thank you so much, Walter, and I want to thank you for your leadership on this issue and so many others. The perspective that you bring, and the concern and the compassion that you bring, and the knowledge and understanding of what the citizens of the 3rd District in North Carolina require and need and want of you is so very important, and I'm honored to be your colleague and serve with you in the House.
Tom, thank you. In just about 1 minute, Glenn Downs, my Chief of Staff, will be on this show, and we look forward to having a further discussion on this issue. Thank you, Tom.
Thank you, Walter.
I'm glad to have Glenn Downs, my Chief of Staff, on for the last 5 minutes of the show. Glenn, thank you for being on the show again. I'm sorry we took so much time, but I think it was very important to the people of 3rd District to hear Dr. Price.
Absolutely. You indicated with Dr. Price that your office was getting a lot of calls on this whole future medical care issue. And I'd like to follow up on that if we can with these final few minutes of the show, because the calls that we've gotten, and the ones that I've taken as a staff member on your behalf, have indicated a concern just beyond just the medical care issue. And
right.
And I guess it's because of this is a gigantic bill that would radically change the way a major portion of Americans' lives would run. It's following up on a bill that Congress voted on not too long ago, the cap and trade, or so-called cap and tax bill, that would really dramatically, it's got the potential to dramatically increase people's electric bills and lower job availability, and followed up by itself with a very large, massive stimulus bill, spending money on projects around the country, and that people hadn't looked at and read. And people, I think, are really concerned, Congressman, about not about just about their personal lives, which they are, but about the general direction of the country. I really sense a real concern about where we are headed as a country. And what would you have to say to them and to that?
Well, Glenn, I share that concern. I have been concerned for quite a few years now, but even more so now than a few years ago, that we're a debtor nation. We're a nation that cannot pay our own bills. We have to borrow money to pay our bills, and yet I see a tremendous expansion of the federal government, and it's got to stop. But the only way it's going to stop is for the people, just like they've been doing on this health care issue, is to call that member of Congress, to call that senator and say, hey, look, slow up before it's too late. I'm very concerned. I share that concern that you just stated.
You know, a few years ago, you took some heat when you were criticizing some spending that was being done by a Republican president and a Republican Congress, and now you're criticizing a Democratic president, a Democratic Congress for overspending. And what can you tell me about or tell the people really rather about the mindset of your colleagues? Why is it that when their party is the one that's overspending, they're loath to kind of to speak out? What goes on in a member of Congress's mind?
Well, that's a good point, because some of my Democratic friends, like Heath Shuler from the mountains and Bob Etheridge and G.K. Butterfield, I think that after they cast their vote on the tax and cap bill, tax and cap. Yeah.
Cap and trade.
Cap and trade. Excuse me, I couldn't get it up. But I think the American people were upset then. The people in North Carolina were upset about that bill. And now I think with this health care bill, it's going to be even a bigger test for many of my colleagues who maybe voted for that energy bill that we just talked about. This is going to be a real interesting couple of weeks, quite frankly.
Well, one concern, one real specific concern that we've heard in the office of people calling in is going to Dr. Price's point about availability of care. People that are new Medicare patients having a very difficult time finding doctors to say, hey, if you're not already a patient of mine, I'm not going to take you. And a lot of people that are on Medicare now are very concerned that if you have another whole giant pool of people coming in with the same kind of pricing power, you have even more people trying to get see the limited number of doctors that'll see people at those kinds of reimbursement rates.
Glenn, that's why Dr. Price said it, and many Democrats have said it, and I've said it, and Republicans. It's time to slow down, to carefully analyze the difficulties of trying to fix the problem. There are ways that we can fix this problem, but we need to have input from everyone that is a part of the system, as well as members in Congress in both parties. Glenn, I see again that I'm sorry that this went so fast, but I think it's been a good program, and I'm sorry that our time was shortened by the appearance of Dr. Price, but it was very important that he have that opportunity.
Absolutely.
I want to say thank you for watching this show. Keep calling your members of Congress, your senators. And I do want to close by asking God to continue to bless our men and women in uniform. And I will close again by saying, God, please continue to bless America. Thank you for watching.
Thank you for taking the time to join us for Washington Watch.